Ontario's chief medical officer of health says the peak of Omicron is behind us, and it's time to look at lifting public health measures sooner than planned. And that could include doing away with vaccine passports. There was no sign of Premier Ford today. He has largely stayed out of sight during all of this. Ontario's top doctor says these protests have nothing to do with looking at lifting measures sooner than anticipated, and he expects to give the government new COVID recommendations next week.
We're making remarkable improvement in all of the key metrics in Ontario, and that forces us to review all public health measures.
Just yesterday, Health Minister Christine Elliott said vaccine passports would remain in place. Today, the Chief Medical Officer of Health said they're under review.
I think it's a prudent time to review proof of vaccination.
Are passports still relevant if we only have 2 doses, where you can still catch it and spread it with 2 doses?
That's an absolutely fair question. Vaccine certificates were really good and really effective when we still had Delta or previously theoretically Alpha. But now it's really an issue. We either go to a 3-dose vaccine certificate, or we need to be aware of that one of the reasons for vaccine certificates is sort of not completely satisfied anymore.
The government has indicated it will not call for 3-dose passports. Under the current plan that may now be sped up, the province would ease restrictions on February 21st and again on March 14th. There are still warnings of caution against moving too fast, though.
While the Omicron wave may have peaked, transmission does still remain high, and the threat is far from over.
But a COVID-weary public may not want to hear that anymore.
How much longer? Do you have that crystal ball?
Well, anytime anyone has predicted an end of this pandemic, they've had egg on their face, right? So, I think, look, I'm still prepared to be optimistic, but I think we need to see a next generation of mRNA vaccine, which I know is under development. We need to vaccinate the world. I'm hopeful that COVID continues to get more mild. That's not an uncommon trajectory for viruses that adapt to a new host.
In a sign things are improving, surgeries that have been postponed and extracurricular activities in schools can resume. But one final note, Dr. Moore believes public health measures like masks will remain in schools longer than out in the general public, largely to give parents peace of mind.